My name is Dr. Rick Seguil.
And action. Hey, Jay had a... This is Kirk And action. Hey everyone, Dr. Rick here, and Kavita had a question about sleep and the architecture of sleep. Well, she didn't really have a question about the architecture, but I'm going to go over it briefly because if you understand the issues, you might be able to see how valuable it is to sleep. If this is the first time you're finding me, don't forget to hit the subscribe button down below and the alert button to find out when I do new videos. Also, as corollary, I'll tell you about this at the end, I have a lecture coming up on September 21st, 2019 at the Hyatt in Schaumburg on medical cannabis and its applications in modern medicine. If you are on the fence or you're thinking about it, and again at the end I'll tell you about a couple of things that would benefit you if you have a sleep disorder, please call my office 630-213-3232 or call VeriLife in Arlington Heights to reserve a spot. So this concept of sleep is really important, and I think I have done videos on resetting your sleep cycle, so check it out. I'll put a link down below. But in this case, or in this minute clinic, I wanted to just go over some of the basics. So this is essentially sleep, what's called a hypnogram. And a hypnogram is the levels of sleep or brainwave function over here and the time over the course of the day. And if you can see, as you get to sleep, and I put early PM and then morning on the other side here. So as you go through the time of sleep, you'll see that the brain goes through certain waves of firing. So the brain is a bunch of neurons, nerve cells, and the neurons depolarize and cause an electric charge. One neuron starts the electric charge, sends it through a connection or a synapse to the next neuron, and then the next neuron, and you have this depolarization thing that occurs. And what we'll find is, depending on your level of sleep or wakefulness, like in the daytime, and when you're listening to me, your brain is firing off at something called beta wave. Keeps you awake. When you get to a boring lecture, like some of mine, not all of them, you'll see the brain waves start to slow down a little bit. So this corresponds with the brain waves, and you go from wakefulness on the top to drowsy, to light sleep, to deep sleep, and then REM. REM are the jagged lines down here. The more REM or rapid eye movement you have, the better the brain resets its synapses and keeps memory. It'll keep memory for just bulk things that you should remember, telephone numbers, conversations, tasks that you completed, and then it'll keep memory for like shooting a basketball or kicking a soccer ball or driving a new car. So all those things take coordination, and if you're not coordinated, I mean pathologically, you will have problems almost like a stroke, or in the more mild function, you'll have problems with memory, and that's why Alzheimer's disease, Parkinson's disease, all those neurodegenerative disorders, they can be sped up with a sleep disorder. So it's really important to address this. I know some people will just say, well, I do fine. I sleep 10 hours a day and I'm great. And then I ask most patients, all right, are you refreshed in the morning? Usually the answer is no. So here's a more common thing that I'll have with all my patients, that my guys especially will get up every hour or two to pee, yet their prostates are normal and they're not taking any fluids at night, which is a no-no. I think that if you're going to have the stimulation to pee in the middle of the night because your bladder can't hold it, which the bladder should be able to hold a good volume, but if you can't and you're waking up every hour, there's probably a pathology. If the urologist has checked your prostate, I've checked you for spastic bladder, and there's nothing going on, kidneys are fine, then there might be a sleep disorder. Sometimes problems with getting into sleep disorder or difficulty with organized sleep, like in the stages of sleep, it'll actually tell the brain, because when you're in deep sleep, you're not supposed to pee. You're not supposed to get up, you're supposed to calm, almost be semi-paralyzed. In fact, that's what happens in REM, is you become paralyzed. Most of the things become paralyzed, and that's where you get muscle rebuilding. That's why I say it's important to have a deep sleep to recuperate from the exercise you did the night before. And on the contrary to that, it's also important to eat properly for the exercise you're going to do the next day, but I'm not going to talk about food. So in the case where you have to wake up frequently and it's not from fluid and it's not from being anxious and listening to everything, or having even a mouse or a floorboard creak wake you up, it could be a sleep disorder. If it's a sleep disorder, the brain doesn't have its firing off properly, because again, the brain's supposed to say in the middle of a sleep, do not pee. And when the brain doesn't fire off properly, some things come up, like go ahead and pee every hour. So an astute urology friend of mine had said, if you have a problem with guy that prostate's okay, everything scoped is okay, get a sleep study, which I totally agree with. So if the sleep study shows we have a little bit of apnea, you might not notice it in the snoring thing or the stopping the breathing, it might just be the pee. Then you fix it and the urination gets better. Deeper sleep, more sleep, deep sleep, especially REM. If you get more REM hits over the course of the night, then you'll have better recuperation, you'll have better wakefulness, you'll have less amyloid development in the brain and less chances for Alzheimer's, which is really important. Alzheimer's, you kind of see if you're high risk by getting a genetic study, which is very expensive. ApoE4 is the gene that says you're at high risk for it. But if you can't afford that, I'd say do everything else that you can possibly. Exercise, keep your body weight low, control inflammation with the diabetes or prediabetes issue, and try to embrace proper sleep. So in the case of Kavita, waking up in the middle of the night and then getting up and doing or performing an action and then getting back to sleep, that's when the brain is acting out. And the brain is acting out. It's not supposed to do that in the middle of the night. It's supposed to stay asleep, stay in one position, and become essentially paralyzed, except for your eyes moving fast, your diaphragm breathing, and a couple other very essential muscular movements. But aside from that, you're supposed to be semi-paralyzed during those REM states. And for some reason, there's several parts of the brain that talk to each other during this beautiful orchestra of sleep that keeps you asleep. So when one part of the brain is not talking to the other part of the brain and the orchestra is off, your sleep will be off. So it's important to make sure if you have any head trauma or if you haven't had an MRI of the brain, get it. I would get it. I'd also look for other issues, heart disease, sometimes when you have to pee frequently, it could be from other things as far as the brain. So really important to talk to your primary care doctor about what your issues are. And then maybe we will send you over to the neurologist or the pulmonary guy. The lung guy and the neuro guy are the ones that take care of sleep, because they've been double boarded in sleep medicine, which is really cool. So sometimes when you do have to get up, or you're in a fight, or you're shooting baskets in the middle of the night, again, that could be an insomnia issue. Interesting to note that a lot of my guys like taking zolpidem, Ambien, and Ambien is a hypnotic medicine. It will get you to sleep, but one of the side effects of Ambien is a parasomnia, where you get up and do a task in the middle of the night. One of the worst things you can do in the middle of the night is go and eat. And when you go downstairs, actually like you're actually awake, but you go downstairs, go fix a sandwich or something, and then eat it and then go back in. You might not remember that, but there'll be crumbs and a knife and the bread loaf open in the morning, and you'll figure it out. But that could be a problem, number one, because I mean, you might cut yourself. Number two, you're going to gain weight in the middle of the night. So if there is an issue with that suspicion, again, talk to primary care. We'll send you over to the sleep guys and we'll get that sleep study. So so that is one of the problems with Ambien. That's, I think, the most notorious out of them all. There's Sonata, Lunesta, Ambien, Ambien extended release. And there also is, so they're all in one category. There's also Benadryl. If we're going to talk about medicines, Benadryl is a go-to medicine because it's over the counter. That's Tylenol PM, diphenhydramine, or just Benadryl. And that makes you sleepy, but it screws up memory the next day because it works the wrong way to the brain. So if you're going to use it just to initiate a reset of your circadian rhythm, fine, but I wouldn't rely on that for a long time. I took that for a while because I was having a sleep issue. And I remember suddenly in the daytime, I would have poor memory of or recollection, and then I'd get dizzy suddenly, which is probably a sleep disorder. There's something called cataplexy, when you're going around and doing stuff, and then suddenly you drop because the brain is getting screwed up. It makes you fall and collapse. So another thing to watch out, but my sleep guys are really good with figuring this out. And then while we're on the medicines, also want to mention there is one medicine called trazodone, which is usually has an antidepressant, but it does work without too many side effects as far as initiating sleep. So I really think if you don't have any of those big diseases, or you're not going through menopause or andropause like I am, then there is a way to train the sleep wake cycle to hopefully get readjusted if you have no other pathology. Like I just came back from California, so my sleep cycle was off for a couple of days, but I have my go-to things that I do to get me to sleep, to get me to wake up, to stay awake, and reset wakefulness and sleep. Those different parts of the brain that are responsible for that. If you reinforce that, as long as there's no underlying pathology, then it might get you to a groove where you get back into this is sleep, this is wake, this is time of eat, this is time of study, all that stuff. And if you get that to a routine, just like training a puppy to poop in the house, to poop outside and not poop in the house, you can train that puppy by repeating the ritual over and over again, and the puppy will get it. And then things are cool. You don't have to clean up poop or pee in the house. But if you tell the puppy, we're going to take you out now, and then the next day, I'm not going to take you out, and then you feed him at irregular hours, that puppy's going to poop everywhere and wake you up all night, and it'll be an unhealthy puppy. So same thing with the human. In fact, there are studies where you take the spinal fluid of a dog that has a sleep disorder, you put it into the spine of the dog without a sleep disorder, and the spine of the new dog that got the spinal fluid from the sleepy dog, they become sleepy. So it's really telltale that there's a lot more as far as hormones and cycling rhythms of hormones that's responsible for deep architecture. So I think that is about it. Benadryl, the hypnotics. Oh, there's also GABA. Now, GABA is a neurotransmitter in the brain. It's responsible for calm. When you take progesterone at night, especially as far as a cream or a pill, it stimulates GABA, in addition to taking care of hot flashes if you're getting at that age. And yes, men can take progesterone. I'd probably do more of the cream if I was a man, but if you're a female, I would go more towards the pill because of the positive effects of progesterone, especially if you're lacking it. It's always important to check blood tests first in the morning. But progesterone's awesome. GABA by itself, if you wanted to stimulate it, you can take a benzodiazepine like Xanax, but it's just so behaviorally addictive that I don't like Xanax in the long run. And I think it'll help relax if you're anxious or if your drive for poor sleep is more anxiousness. But I think it also will rob you of REM sleep in the long run. So, and it's a controlled substance. I just don't think it's a wise idea. Which is why I'm going to dovetail into what I'm going to talk about on the 21st. And that would be medical cannabis. And here are a couple of things I've done videos on. This is one form of CBN. Really nice product, a little pricey. There's only 10 of them in here. There's also Rhythm, which is kind of cool. Mostly half and half CBD, THC. There are candies that you can use. There is also this, which a lot of patients have told me, chocolate. This has worked great for my female patients for some reason. I don't like it. But taking a quarter to a half of one of these things every night will also reset your circadian rhythm. I have so many patients that are doing well with medical cannabis and without any side effects, even the 7 to 80-year-olds. So if they can tolerate it, then I'm pretty sure a 30 to 40-year-old can tolerate it too, at least to reset your circadian rhythm back into normal, especially if you're a flight attendant or just coming back from a different part of the world. So I don't suggest the syrup because I'm supposed to mix it in fluid to take it down. And again, if you take a lot of fluid or even just a hint of too much fluid at night, it's going to make you pee eventually. Ah, yes. The other thing I didn't mention was alcohol. Alcohol can be used as something to initiate sleep. It'll make you sleepy. But the problem is the elimination time of alcohol that gets to the liver, within about 4 to 6 hours, it's going to wake you up because it'll be out of your system, unless you have a liver problem. And if it's out of your system, you'll be exactly where you were right before you took the alcohol, which is wide awake. The other thing alcohol does is a diuretic, so it makes you pee, and again, it might have that pee issue in the middle of the night, which doesn't help because you wake up in the middle of the night. So I think in the long run, and alcohol's got too many calories, and it also causes dependence. So I wouldn't do that in the long run. A shot of whiskey for sleep, no. So also watch the amount of caffeine you take, because even taking caffeine 12 in the afternoon might still affect you later on. If you have to use anything to wake you up, I would do red reishi mushroom. I'm sorry, I would do reishi. Sometimes, sorry, not reishi. Rhodiola. Rhodiola is an adaptogen. It supports the adrenals and it makes you a little more awake. There's also thyroid energy. I like Now Foods brand because of its B12, zinc, selenium, and iodine in the daytime. Sometimes if you're totally stressed out, you can take ashwagandha. I don't have the samples here. Then again, balance your hormones. If you are menopausal, perimenopausal, for the time being, if you're trying to lose weight, reset your circadian rhythm, you might want to do a short burst of estrogen, bioidentical, I'll put a link down below, and progesterone at night. If you're a guy, you might want to do testosterone in the daytime, jack you up, give you wakefulness, and then something else at night, calm, like topical progesterone or ashwagandha. So those are my hints. If you have any comments down below on what you found with your sleep disorder, please put them. Otherwise, again, don't forget to subscribe to me. And if you're around the Schaumburg area, I'm giving the talk that's being hosted by Verilife. Schaumburg, Hyatt, 1 o'clock till whenever. I'll try to broadcast it on YouTube, but it'll be Q&A mostly, and that's the awesome part of lectures. So don't forget to subscribe. If you have any other questions, put them down below. Otherwise, thanks for watching up until this point. I'll see you at the next Minute Clinic.